Our next story is about how COVID-19 has impacted our lives in more ways than one. I'm not just talking about the economy or the energy sector. I am talking about how it has impacted progress that has been made against other diseases, specifically tuberculosis. First, the basics. Tuberculosis is the second deadliest infectious killer after COVID-19. It is caused by bacteria that most often affect the lungs, and it can spread when people who are sick with TB expel bacteria into the air, for example, by coughing. TB mostly affects adults, particularly those who are malnourished or have other conditions like HIV. More than 95% of the cases are in developing countries. Now, to the latest assessment, which is grim and raises concern over the spread of this disease. The number of people infected with tuberculosis increased globally for the first time in years. This is according to the World Health Organization. According to the UN Health Agency, more than 10 million people worldwide fell ill with tuberculosis in 2021, and this is a 4.5% rise as compared to the year before. More than a decade of progress was undone thanks to the emergence of COVID-19 in 2020, essentially. Let's talk about the battle against TB now. Overall, a lot of progress has been made when it comes to preventative therapy, but there is a long way to go when it comes to just about every pledge and goal regarding TB. The WHO also blamed COVID-19 for much of the rise in TB. Basically, the pandemic continues to have a damaging impact on access to TB diagnosis and treatment. Progress that was made before 2019 has slowed, stalled, or reversed. With fewer people being diagnosed with the disease, more number of patients unknowingly spread tuberculosis to others, and this may not have been spotted in countries with weak health systems. The WHO reported that the number of people newly identified with TB fell from 7 million in 2019 to 5.8 million in 2020. Not just that, COVID-19 restrictions negatively impacted TB treatment services, and this may have led to some people not going to health facilities because of the fear of catching COVID-19. And even the downturn in the global economy was a contributor. About half of all TB patients and their families face quote-unquote catastrophic total costs due to the treatment. And speaking of treatment, according to the WHO report, only 1 in 3 people with drug-resistant TB are receiving treatment. And there is also the added element of the ongoing conflicts in Eastern Europe, Africa, and West Asia. They worsened the options for patients seeking TB diagnosis and treatment. So what now? The WHO has called for more countries to cover all TB diagnosis and treatment expenses. There is a need to lower the prices of TB treatment, and overall, an urgent need for scaling up shorter, safer, and more effective treatments. WION now available in your country. Download the app now. Get all the news on the move.